So no vaccine is 100%. These vaccines in the trials, in the studies that were done, look very promising. They look 94 to 95% effective. We're not clear how they're going to perform in the actual administration in people, but we have high hopes that this is going to work well and that this is going to control disease. So much so that I have looked at both the safety data and the efficacy data, and I personally am getting this shot.
So it's one of the most effective vaccines we have. We're really excited about that. We would have been happy with just greater than 50% effectiveness, which is kind of on the order of a flu shot. Flu shots are good, worthwhile, but you can still definitely get the flu after you get a flu shot. But this one is about 94% effective against getting COVID-19. And then all of the serious cases of COVID-19 were only observed in people who got the placebo shot. So we're thinking it might be almost 100% effective against serious cases of COVID-19, which are the main thing we're worried about. We're not just trying to keep people from getting sick, we're trying to keep people from getting hospitalized and dying. The speed with which this vaccine is coming out is not due to cutting corners on safety. It's been due to a lot of remarkable efficiency gains. One is that we already had programs to study vaccines in place, and we could just fit these new vaccines into those same programs, so we didn't have to rebuild the wheel to study us. The biggest thing is probably that they started manufacturing while they were still studying the vaccine. It's a really simple vaccine. So, it used to be we had to grow virus and eggs, and it takes a long time. Now it's just a little bit of genetic code in an oil bubble. It's just phenomenal how simple it is and yet so effective. But the simplicity means that it's really easy to produce lots of, and there's fewer safety concerns with it.
So our vaccine plan has 5 areas of priority. We have healthcare and other personnel that may go into homes at a moment's notice. Indian child welfare, a home repair person, behavioral health counselors, law enforcement, those kinds of categories. So those were our top priority. Critical frontline staff next, people over the age of 55 and medically fragile, meaning they have an underlying disease or medical condition that may put them more vulnerable to COVID-19. We are hoping to even expand beyond that to what we might call friends and family, maybe school personnel, as the vaccines are available to us, and we'll be working on securing enough doses to do our part and help get these vaccines out in the general community as well.
So we know that this vaccine is going to roll out every week to clinics around the state of Washington, including the Port Gamble-Squalin tribe. As these roll out, we'll expand the priority groups that we vaccinate. I would anticipate that by February, we will have quite a few people vaccinated, as the majority of our vaccine is going to start rolling out.
The last 2 weeks, we have vaccinated 200 people each week in large vaccine events. And we'll continue to, we we estimate that we'll be able to continue doing that for the next couple of weeks, hopefully even expanding to 300 during the month of February. So as long as we continue to get the vaccines as we plan, I think, by the end of March, we should be able to have our community vaccinated, hopefully before then even. Like I said, there has been some discussion about what role can we play to the local school district and to some of our neighboring community even, recognizing that the north end of the community also has needs to be vaccinated. So it puts us all at further risk if we don't help with testing and providing vaccine to the local community as well.
Even though we have a high degree of confidence in this vaccine, we are going to be really careful as we roll this out. Everybody is going to be observed for at least 15 to 30 minutes after they receive the vaccine. We're going to have everything set up to handle an anaphylactic reaction or other serious reaction, even though none have been observed with this vaccine. And we're going to be following people after they get the vaccine. We want to know their stories. We want to know, did they get fatigue? Well, how bad was that fatigue? Did they get pain? How bad was that pain?
So I was one of the initial people to receive the first dose within our first group of 10. And I didn't experience any side effects. A slight headache for a very short period of time the day we received the dose, but nothing after.
My experience getting the vaccine was just like any other flu shot or vaccination growing up. The clinic staff know what they're doing. It was pretty painless as far as shots go. I had no side effects or symptoms, but my arm was super duper stiff for like 4 days.
I had a sore arm for a few hours. It wasn't really bad. And by the next day, the pain was a little more localized to the injection site. By the third day, any kind of discomfort I was experiencing was completely gone.
It was it went in, it was a small needle. I didn't feel anything. And the side effects for me were very minimal. It was like a flu shot. You get a little bit of a soreness. And I felt that evening. And by the next day, there was nothing there. I received my second Moderna shot today, and I am still feeling okay.
The first time I got the vaccine, I was really nervous about it. I just didn't know if I would have side effects, and that caused us to be anxious. But nothing happened to me. I didn't have any side effects. I felt relieved a couple of days later because I didn't have side effects, and I felt like we were on the path of moving forward with our tribe being able to be vaccinated, and I felt really excited.
We are asking people who get vaccinated to use the CDC's V-Safe program. It's a texting program, and it just does starts off with daily and then moves to weekly check-ins just to kind of check in on your symptoms, and it helps build the research up for the vaccines from the CDC. And it's very quick and easy to use, so we're just really strongly encouraging people to utilize that if possible.
Even though we're all getting this vaccine, we're still not clear how well this is going to protect ourselves from getting infected or transmitting disease. So until we have a clearer picture of the effect of this vaccine on the outbreak, we're all going to still have to continue social distancing. That's the 6 foot that we're using now, and wearing masks and using respiratory hygiene.
These safety protocols that we've put in place have not only helped with the spread of COVID, but also with flu. And You know, as I said, there are several people still choosing not to get the vaccine because of their own questions or feelings about just being vaccinated in general. So there's still going to be some risk that we're uncertain about. And until we have more of the population or the general population vaccinated, there still poses a risk to all of us. And if we want to move back to these activities that we're desperately missing right now, we need to get as many people vaccinated as possible. We need to keep wearing those masks. We need to keep washing our hands. We need to keep using sanitizer and you know, as often as possible.
So I don't think we will ever return to completely normal in our minds. We will always have COVID-19 circulating like influenza. And I think it's a good chance for us to learn from our experience with influenza, from COVID, how we use respiratory etiquette, how we get vaccinated to prevent disease and transmission, and that our new normal is going to be a modification of our work habits, our vaccination, and our respiratory etiquette and social distancing. That will be our new normal.
Getting as many people vaccinated as possible is our goal, and experiencing some side effects is certainly an inconvenience, but for the future and being able to, you know, hold your loved ones and celebrate many things, including celebrations of life, will be available to us if we're all vaccinated. And I really feel like that's truly important to our community, really important to our culture, as well as our kids getting into schools and feeling safe at schools, having our teachers feel safe at schools. You know, that we just want to feel safe again.
If we want to get back to some kind of normalcy like we had before, we really need people to vaccinate.
Full disclosure, I feel like people do worse things to their bodies than this every day. And if this is something I can do to just kind of peace of mind for myself, I want to get back to work. I want to go visit my family. I see friends in the store who I haven't seen for years that I can't hug, you know. So it might be kind of a self-talk thing, but I just wanted to get it, to put it behind me.
This is about the people that you love, the people in your community. You know, it is an individual decision, and it is something that you are putting into your own body. But the reasons behind that, you know, they outweigh anything in my mind. Just making sure that we are humans, we care about each other, and to keep our community safe and those we love, and even just abroad, you know, humans, people in general. It's just, for me, it's the right thing to do.
I just encourage people to get the vaccine, to pause, you know, just do it. Just do it so we can be together again. And I think it would be so much better for us if we could just come together as a community again and go through the proper grieving of losing our community members that we have. And I think that would heal us so much more. So please just get the vaccine.
I would say that we should listen to our medical staff, and I would say that they've gotten it right through this whole thing. And if we just listened to them from the beginning, we would have been more safe as a community. And right now they're telling us that the vaccine is safe, that the vaccine is the right thing to do. And I support that. And I think that it's the right thing for all of us to go get vaccinated. And if you're hesitant, do some research, understand what you're walking into, because there's potential that you could get sick. There's potential that you could have some side effects. But in the end, the right thing to do, and the thing to eliminate this virus, this disease from our community, is to get vaccinated. I just want to say I appreciate everybody that has done all the work to try and keep us as safe as possible. And I know that it's been difficult for our families. It's been difficult for all of us. I think that we're heading in a good place, and I really appreciate where we're going. I appreciate all the leadership. I think we've done as much as we could. Could we have done better? Of course. There's always a way to do things better, but we know so much more now, and our experiences have taught us a lot, and I really feel like we're going to be stronger at the end of the day.